So our next talk is by Dr. ABISHA. She'll be presenting on Do It Yourself at Wetlabs.
Good morning, everyone. Coming to my topic, wet lab training. As a resident is concerned, there exists a multipolarity at the level of ophthalmic surgical training. There are people who have done lot of surgery and on the other hand, not even done a single surgery. And there exists a different learning curve also for all of us. So there comes the importance of wet lab, which is a safe and standardized method for training without the risk that can come while operating on real eyes. It will make us better equipped on real eyes. We can do the same surgery without complications or failures. It can enhance the psychomotor skills, hand-eye coordination, ambidextrosity, and it will create less stressful environment. Coming for the setting of a wet lab, we should have adequate space, equipments, instrument, and should we have a proper curriculum. Ideally, the wet lab should be located within the main hospital building so that we can approach whenever we are free, and it should be spaces to accommodate at least 2 people, 1 trainer and a 1 trainee, and should be ideally 10 cross 10 feet. This is a wet lab setting in my hospital, and it should be an air conditioned room with a refrigerator and microwave oven, an operating microscope, whiteboard with chair and table, preferably adjustable chairs, sink tap, and biomedical waste management system. Coming to equipments and instruments, at least for SICS wet lab, we should have a microscope with a side scope or camera connected to TV screen so that we can record the wet lab training and we can assess our progression. For phacoemulsification, we should have a phaco machine with tubings and expandables. Depending upon the nature and type of surgery, we have to get sutures, gloves, blades, eyes as well as fluids. Surgical instruments, minimum surgical instrument set should be available within the wet lab. And eyeball fixating devices, either in the form of mannequin or styrofoam head or eyeball fixating stands like this should be available. And we should have a design training curriculum, since as we all know, a resident is always confused on how or what to start. In our institute, after 3 months of joining, we will be having 15 days of lecture as well as wet lab practice, followed by OT surgery. We will be under one-to-one care under the guidance of a trainer for first 15 cases. Along with that, pre-operative as well as post-operative ward rounds and video discussion makes us perfect. We were advised to do suturing, which is a vital ingredient which will increase our hand-eye coordination and dexterity under microscope. We were advised to do 50 good radial sutures with proper depth and spacing using 10 nylon during the initial days. These were that I practiced. And coming to eye preparation, either we can get rejected or unfit donor cornea or eyeball from eye bank. Wax or artificial eye can be used like phaco or eye phaco, or animal eyes like goats, bulls or porcine can be available from local butchers. Coming to surgical anatomy of goat's eye, for a beginner, usually the rhexis is little bit difficult in goat's eye, since the lens thickness is twice that of humans and it is a soft cortical lens, which can be used for trenching in phaco. And there is blue reflex rather than red reflex in humans. Bull's eye anatomy, the scleral thickness is more comparable with that of humans, which will make the tunnel making perfect. In porcine eye, it will the anterior lens capsule mimics pediatric ALC, which is thick, more elastic and viscous. These are few images that we usually do in our wet lab with goat's eye, peritomy, tunnel making using crescent, capsular rhexis. For capsular rhexis in our institute, we usually use a discarded IOL, opened or damaged IOL package. Like this, we'll make rounds and we can practice rhexis. Phacoemulsification, coming to phaco wet lab, for the phaco dynamics as well as foot pedal adjustment, we can get well trained in wet lab. And we should have a logbook maintenance to assess the progression. And we can follow IC Oscar grading for SICS, which will be dealt detailed in later. So all residents, go get trained in wet lab. Surgery is an art as well as a learned science. Thank you.